as well as freshers. So if you are having the experience, you can stay. If you have qualified with CPC, you can stay. So okay guys, thanks for attending this demo session. So SDS live chat demo. So only for CPC certified coders. Okay. So before starting our session, I would like to tell you about myself. So my name is Harish Gupta. I am the creator of FastCoder 21 Medical Coding YouTube channel, and currently I am working as a ambulatory surgery trainer in one of the MNC in Hyderabad. Okay. So nearly I have 9 years experience in medical coding. So during these 9 years, I have coded all types of charts. Okay. So my intention is to always share knowledge, gain knowledge. Even my channel motto is also same: share knowledge, gain knowledge. So as much as you share, that much you will get back. Okay. So next. So anyone knows types of surgeries, guys? So what is the difference between SDS, AMS, general surgery? Anyone knows? You can try your best if you anyone knows that.
SDS means outpatient surgery, like same day admit and discharge.
Okay, fine. That is same day surgery. Then what is AMS?
It's like minor surgery.
Okay. So then what is general surgery? Any guess, guys? You can try, no problem. So no worries. So basically, SDS means same day surgery. Okay. So this SDS coding is related to the hospital's outpatient. Okay. So you are having hospitals, correct, in US. In hospitals, they have outpatient departments also. Okay. If the patient came into the hospital's outpatient department, you will code it as SDS coding. Okay. So next one is AMS, or ambulatory surgery centers. So in US basically they are not hospitals. They are the freestanding centers. Only they will perform minor and major surgeries. Okay. So those are the AMS. Okay. For SDS coding, hospitals will be OPPS, outpatient prospective system payment. Okay. For ambulatory surgery centers, they will use APCs, ambulatory payment classification. Okay, so that is the difference between SDS and AMS. Why means if you go to interview, they will ask you what is the difference between SDS and AMS. Okay, so what is SDS, guys? Anyone got now or not?
Outpatient and same-day surgery.
Yeah. Yeah.
Same day
Basically,
surgery.
yeah. Hospitals outpatient surgery department. Just remember like this: hospitals outpatient surgery department. Okay. AMS means what is AMS?
Ambulatory surgery.
Yeah, ambulatory surgery centers. So basically, these ambulatory surgery centers are not related to any hospital. So they are freestanding. Means they are having their own rules and regulations. They are not at all related to hospitals. Okay, for them we are having APC classifications. Otherwise, we will call it as ambulatory surgery payment classification. So what is general surgery? So someone told they are doing general surgery, correct? So what is general surgery, guys? Anyone knows? So basically this is simple. So general surgeon will perform the surgeries which are not related to the specific system. Okay. For example, patient is having the mass on the ankle area or chest area. Okay. So do you think like thoracic surgeon is needed to remove the chest mass? Is needed or not? Anyone can remove, correct?
No.
Anyone can remove. It is on the external surface of the chest, correct or not? Okay.
No.
So
Yes.
yeah, basically here the general surgeon will perform general surgeries which they will perform on the external surface. Okay, they will not go inside. Just for example, cyst, mass, like hemorrhoids. Okay, so those are the external surgeries. Here, general surgeon will perform these procedures. Okay, so that is the difference between SDS, AMS, and general surgery. Why means these are very very important if you go to any interview. Okay, okay. Next, today we are going to learn bronchoscopy. Okay, so what is bronchoscopy, guys?
Visualization of lungs.
Not in the bronchioles. Anyway, you no need to worry. So we are having the images. So what is bronchoscopy? A bronchoscopy is a procedure that allows a doctor to see inside your lungs and using a thin lighted tube with a camera. It can help diagnose and treat lung problems. Okay. Most of the time, these alveoli and bronchioles all are included in the lungs, correct? So if the physician wants to examine these alveolar bronchioles in the lungs, physician will use the bronchoscopy. Okay, so this is so diagnostic procedure basically. Most of the time diagnostic. So if the physician, for example, physician is performing the diagnostic procedure. Okay, so during the diagnostic procedure, if the physician encounters any type of abnormality, physician will convert into therapeutic procedure. Okay, so during the diagnostic procedure, if the physician converts into therapeutic procedure, we will code only diagnostic bronchoscopy. We will not code surgical, we will code only surgical bronchoscopy. We will not code diagnostic bronchoscopy. So that is the CPT guideline. Okay. So next, biopsy. A biopsy is a medical procedure that involves removing a small sample of tissue from the body for examination under a microscope. It can be used to diagnose illness or medical conditions. Okay, so basically why we are reading this one is these three are related to this bronchoscopy procedure which we are going to learn soon. Okay, that's why in order to go to learn bronchoscopy chart, we need to understand the terminology related to that procedure. Okay, so biopsy, basically biopsy is the process of examination of the tissue using the microscope. Okay, so here biopsy also some scenarios we will consider it as diagnostic. Okay, for some scenarios we will consider as therapeutic. Okay, next, ball, bronchoalveolar lavas. This is the most common procedure we will encounter in the SDS coding. Okay, ball often performed during a bronchoscopy is a procedure that collects a fluid sample from the lungs to help diagnose lung conditions, infections, and other tissues. Okay, so basically lavas. So wherever you see the lavas, here fish will inject the normal saline. Okay, and he will perform the cleaning of the lungs and bronchioles and bronchus. So from there fish will aspirate the fluid and he will send that fluid to the pathology department. Okay, so these are the definitions needed to understand before coding bronchoscopy procedure. Okay, so what is bronchoscopy, guys? What is bronchoscopy?
Visualization of bronchi and alveoli.
Yeah, correct. So visualization of bronchi alveoli. Okay, next we will see this is the anatomy. So bronchoscopy. So this is the most of the time all the scopes are like this only. The entry point is different. Okay, so this is the bronchoscope. So must and should physician is to insert bronchoscope through the mouth. Correct. So if you see the colonoscopy, so for colonoscopy the starting point is anus. Okay, and one more important thing here you need to remember that all these scopy procedures are non-invasive procedures. Okay, so what is non-invasive, guys? Anyone knows? What is non-invasive?
Without incisions.
Yeah, perfect. So non-invasive means here physician will not perform any type of incision. So directly using the natural orifice, physician will insert the scope. So that is the non-invasive procedure. Okay, so invasive means here physician will create the open incision. Okay, so for example, if you go to interview, they will ask you, so what is invasive, what is non-invasive, and what is minimally invasive. Okay, so this is the non-invasive procedure. Invasive means physician will create open incision and he will dissect the tissues and he will reach the bone or diseased area. Okay, so this is the bronchoscope. This is the end point. These are the bronchus and bronchioli, and this is the trachea, esophagus, trachea, right lung, and left bronchus. Okay, so how many lung lobes are there, guys? Anyone knows? Any?
Five.
Five lobes. Five
So
lobes.
Five lobes.
so with
Left
Five
two,
lobes.
right three lobes.
yeah, right three lobes.
Right three,
Yeah, correct.
left
Left to
two.
two lobes. Correct. So total we are having the five lobes. Okay. So this is the anatomy related to bronchoscopy. So this is the bronchoscopy instrument. Okay. So next we need to understand bronchus anatomy. Why means most of the time using the bronchoscopy, physician will perform part of the lungs as well as bronchus examination. Okay. So this is the trachea. These are the bronchioles. Okay. These are the left to main stem bronchus. Okay. So this is the main bronchus, right? Main stem bronchus. This is the main bronchus. Okay. These are the bronchi. These are the left lobes, pleura, pleural fluid, and these are the lobes. So we have discussed correct three lobes. One, two, three. Three lobes on the right side, two lobes on the left side. Okay. So this we need to understand. Why means we are going to code one bronchoscopy procedure. For example, in the operative report, if you see the bronchiole, you need to understand where is the bronchiole. So bronchiole is the last point of this bronchus. Okay. Next, this is the tracheobronchial tree. Okay. So these are the tracheobronchial cartilage. So larynx, trachea. So these are the primary bronchi. These are the primary bronchi. These are the secondary bronchi. See, this is the main bronchus, primary bronchi and secondary bronchi. So this is right lung, this is left lung. These are the terminal bronchioles. Why means in the operative report, physician will directly mention. So I have reached the primary bronchi, secondary bronchi, and bronchiole. So if you see secondary bronchi, you need to consider it as physician has crossed the primary bronchi. Okay, so this basically anatomy is very important for surgery coding. So if you know the anatomy clearly, we can code any operative report. Okay. So next we are having the carina. So this is the landmark for bronchoscopy coding. So this is the primary bronchi, trachea. This is the carina. Okay. So next, this is the chart we are going to discuss now. Okay. So this is the live operative report basically. So here physician has performed navigational bronchoscopy with right upper lobe transbronchial biopsy, brush plus ball. So what is ball, guys?
Bronchioalveolar lavage.
Yeah, perfect.
Lavage.
So bronchoalveolar lavage. Okay. So this is the carina, sharp and central. So this is basically physician has performed this procedure. These are the procedure performed by the physician. Okay. Now he is like explaining the findings here. How did he perform the procedure? So carina, sharp and central. So this is the carina, correct? So from here, physician has started. So this is the carina. So he is telling sharp and central. So normal anatomical location of this carina is the middle or central. So here physician is telling that is sharp and central. Okay. So this is the starting. A medium bronchoscope was introduced through the endotracheal tube and advanced to the tracheobronchial tree under direct visualization. Okay. So this is the tracheobronchial tree. Okay, physician has inserted the bronchoscope through the here and he examined here up to carina he has reached. Okay, so trachea is also visualized during the bronchoscopy. So tracheal rings had normal caliber. There was no dynamic collapse. The scope was advanced to carina, which was sharp. All segments of the right and left lung visualized. Okay, so physician examined this carina also. During this bronchoscopy, physician will examine trachea and this carina. After carina, he will examine the bronchi. So here physician is telling all these things. And as lastly, he will examine the right and left lungs also. Okay, so these lungs also visualize it to the physician. Okay, next bronchial tree. So now he is telling about findings in the bronchial tree. So patient with no endobronchial lesion or mucosal irregularity. Okay, so now he is telling navigational bronchoscopy with ball plus breast plus TBBX done with local bleeding which subsided with cold saline lavas. So EBUS not done. So what is EBUS, guys? So basically EBUS is the ultrasound, endobronchial ultrasound. So here he is telling that I did not perform any endobronchial ultrasound. Okay, why means if the physician performs endobronchial ultrasound, we need to alter our CPT codes. Okay, so physician telling he has performed all these procedure. So total how many procedures, guys?
3 procedures.
Yeah, perfect. Yeah, 3 procedures. Okay, so specimens ball. So right lung 6.55 100 ml in still 50 ml. I told you na during the ball process physician will inject the normal saline solution and he will clean the lung lobes and bronchi. Okay, cytology breast right upper lobe. So in the right upper lobe physician has performed the breast biopsy. Okay, so after performing this brushing, physician will send samples to the pathology department. Okay, next transbronchial lung biopsy. Okay, so TBBX. TBBX means transbronchial lung biopsy. Why means most of the time in the operative report you will see short forms. Okay, TBBX like that. So TBBX means transbronchial lung biopsy. So right upper lobe. Navigational bronchoscopy with fluoroscopic guidance. Okay, biopsy are performed using forceps. Terminal bronchiole was punctured and lung tissue was obtained and sent for histopathology examination. Okay, so procedure tolerated well, complications bleeding small amount. Okay, here in this small scenario we are having multiple interview questions. Okay, so first one is what is bronchoscopy. Okay, next one is what is ball. Okay, next one is what is navigational bronchoscopy. Okay, next one is what is cytology. Next one is what is histopathology. Okay, and these are the, and next very important guideline is bleeding control. Okay, like in this small scenario we are having 6 to 7 interview questions. Okay, for example here we are having the one guideline. Okay, whenever patient performs endoscopy procedure we can't code the control of bleeding separately. Okay, so all endoscopies includes control of bleeding in inbuilt, means we no need to code control of bleeding separately. Okay, why means during the endoscopy procedure minimal amount of bleeding is possible. Okay, if the patient performs that bleeding control in another area we can code, but same area where patient will perform the examination as well as this control of bleeding we can't code. Okay, and one more last one important one is diagnostic and therapeutic bronchoscopy or endoscopy. Okay, so tell me guys, if the patient performs diagnostic endoscopy and surgical endoscopy at the same location, will you code both codes or single code? What do you code?
Surgery code.
Yeah,
Surgical.
therapeutic
Single
only.
code therapeutic.
Yeah, perfect. So then which scenario you will code both procedures?
Different location.
Yeah, perfect. Yeah, if the patient performs different locations, one location contains diagnostic procedure, in another location if the patient performs surgical procedure, that time we can code. Okay, so for now we need to code for CPT codes, correct? So we'll go to our CPT book. So see here endoscopy. Okay, so bronchoscopy is also one type of endoscopy. Wherever you see any scope, all are comes under endoscopy only. Okay. First, what did physician perform in the operative report? What is the first procedure, guys?
Navigational bronchoscopy.
Yeah, yeah. First, yeah. Anyone we can code.
Biopsy.
Yeah. First, we need to code minimum codes. Okay. First, physician has performed brushing. Okay. For brushing, we will use this one 31623. Okay. So this is for brushing. Then physician performed washing also, correct? Okay. No washing. No need to code for washing. Okay. Next, we need to code for ball. Okay. We will code for ball here 31624 with the bronchial alveolar lavage. Okay. Next, we need to code for TVBX. Okay. So this one. For TVBX, we need to code with the transbronchial lung biopsy single lobe. So how many lobes physician has performed the, so which lobe physician has performed this one TVBX, guys?
Both
Right upper.
Right.
Yeah,
Right upper.
Both
perfect.
upper.
right.
Yeah, right upper lobe. So here we need to code only one code. Okay. So like that we need to code only one code. So you see the guideline here 31628 should be reported only once regardless of how many transbronchial lung biopsies performed in a lobe. So irrespective of number of biopsies, we will code only one code 31628. So if you see here, they have mentioned in the bracket S. S means what is the meaning of this? So they are telling you can code this code if the physician performs single biopsy also 31628. If the physician performs 20 biopsy also, you can code 31628. Okay. So that is the guideline here. Next, we need to code for navigational bronchoscopy. So see here, this is the keyword for navigational bronchoscopy. So here basically we are having four keywords. One is navigational bronchoscopy. Okay. So always try to remember you can't code from the heading of the operative report. Okay. We need to code from the physician documentation. So see here, navigational bronchoscopy with ball plus brush plus TVBX done with local bleeding which subsided. So this is the confirmation that physician has performed these four procedures. Okay. So basically here physician has performed the three procedures. So this is for navigational bronchoscopy. For that we need to use this one. So this is a add-on code basically 31627. So bronchoscopy with computer assisted image guided navigation lived separately in addition to the primary procedure. Okay. So will you code 31627 separately or not? Without primary procedure?
We need primary procedure.
Yeah, perfect. As it is a add-on code, you can't code this code along with any without primary procedure. Okay. At any situation, you can't code add-on code separately. You need to code along with primary procedure. So that is the guideline. So total how many codes are there now?
4 codes.
Yeah. What are those?
4 codes.
Yeah. So these are simple, correct? Yeah. What are the codes?
31623,
Uh,
31624,
yeah.
and that add-on primary 31627, 31628.
Yeah. Perfect. Okay. So like that, we need to code these procedures. So any doubt, guys, here? Are you able to understand clearly or not?
Yes.
So what about the modifiers?
During training, we will learn all those included already. Okay. Anyway, I am coming that point only. Okay. So if you don't have here, we are going to, I am going to show whatever you can learn during this training. Okay. So what do you learn during this training? Okay. So during this training, you are going to learn modifiers with example scenarios. Okay. Each modifier with example scenarios. Okay. These are very, very important. These all topics are 100% important for your interview purpose. Okay. So why means if you go to interview, they will ask you. So they will ask you, for example, 58 modifier, and they will ask you to tell one example scenario. So which scenarios we will examine, like we will learn during the live training. Okay. Next, NCCI edits. So we will learn how many NCCI edits are there and what are the criteria in order to use the 59 modifier. Okay. Next we will learn common surgical instruments. Why means if you want to code the operative report, you need to understand what are the instrument used by the physician. Okay. So we will see common surgical instrument during our live training, and also we'll learn types of incisions. Okay. Why means most of the time in the operative report for invasive procedure, physician will create the incisions. Okay. Based on the incision, we can understand where physician is performing the procedure. Okay. So we will learn types of incisions. Okay. Next we will learn surgical positions. Why means based on surgical position, you can understand what is the procedure physician is going to perform. Okay. So we will learn surgical positions. Okay. Next we will learn operative report components. Okay. So what are the components of operative report and where to pick the diagnosis. So all those things we will learn during our live training. Okay. Next we will learn choosing keywords from operative reports. So how to choose the keywords from the operative reports. Okay. And also you are going to learn how to lead index. Okay. How to lead index. Each and every case. So I will tell you how to lead the index. Okay. Next I will teach you 3M software with Epic software. Okay. Why means if you go to interview most of the time, so Epic is the 3M with Epic is the most common software you can encounter for inpatient and surgery coding trainings or surgery coding, live coding. Okay. So here I am going to show you 3M software with Epic. Okay. And during this live training, you are going to learn 40 to 45 charts with index leading. Okay. I will teach you how to lead in the index. Okay. These 40 to 45 charts include 1 to 6 series. Okay. Next, at last, we are going to learn very important Q&A for interviews. Why means so far I have like taught nearly 100 plus students. Okay. So whoever the goes to interview, they will ask the questions or answers for me. Okay. So I have noted down all those questions and I have created the answers for them. Okay. Those are the most common interview questions for ambulatory surgery interviews. Those you will learn during our training. Okay. So that is the thing here you will learn. So what is next? Yeah. And our other trainings are dermatology trainings, orthopedic surgery, respiratory training, cardiothoracic surgery, IVR training, urinary system training, OBGYN, nervous system and pain management. Okay. So these are the trainings we will undertake. Okay. So
Now she is decided to go for a